Thank you, Senator, for reaching out to us and being present here today. We stand ready to serve with you and help you in this. Senator John McCain.
Well, thank you, Bob. Thank you, Bob. Thank you for your leadership of this incredible place of healing that is called Phoenix Children's Hospital. You know, we stopped to see some of these young people who are here with their families, and it's very touching. I just saw a young girl with her family that has just been diagnosed with a brain tumor, a beautiful little girl, and our prayers are with her as all the many others that are here under this outstanding care that's going to get a lot better once they complete construction of this tower, this $480 million project that will continue to provide much needed pediatric care and services throughout the Southwest. As some of you may know, we have two sons who also were premature and were treated here, and I just ran into two of the nurses who cared for both Jack and Jimmy, so it was very, very touching. They did a great job. One of them's a Marine, and the other one's going to go to pilot training in the Navy, so I'm not sure they made him smart, but they made him healthy, so so I just want to say that we're proud of the great work you do here for the community. And let me just lay out the scenario in Washington for you. It's very likely there will be an all-out effort to enact some kind of health care reform in the Congress of the United States between next Monday and the first week in August, when we will go into recess. The issue and the arguments are being made. As you know, the President is traveling the country and inviting individuals and networks into the White House on this issue. It is the top of the agenda. I left one of the committees I was on to go on this committee called the HELP Committee, Health, Education, Labor, and Pensions, because I knew that this fight was going to, or this issue was going to be heavily discussed and debated. And I think that we all understand that, at least I think we understand that there are competing philosophies about the role of government, not just in healthcare, but whether we should own automobile companies or not, or whether we should own banks and financial institutions. And part of it is what role the government should play in healthcare in America. It plays a big role already, as we all know, in Medicare and Medicaid. So the question is how that'll all be sorted out. And let me just point out one fundamental fact that I think we cannot lose sight of as we go through this debate. The best quality, highest quality health care in the world is in the United States of America. It's not in England, it's not in Canada, it's not in Saudi Arabia. It's here in the United States of America. So the problem with health care in America is not the quality of it. We have to preserve that quality. I think that's two key objectives we have. One, preserve the quality, and second, make it affordable and available to all Americans. That's really what this debate and discussion boils down to. And the question is how are we going to do it? No one believes that the escalating costs of health care is sustainable. Medicare now has a $41 trillion or $43 trillion, I've forgotten, $1 trillion unfunded liability. In other words, a debt that's been accumulated that somebody's going to have to pay off at some point. The system is not sustainable. We are talking about 1/6 of this nation's gross national product. 1/6 of it. Of a several trillion dollar gross national product, 1/6 of it is consumed by healthcare in America, and that cost is rising. Demographics, healthcare cost, all of those reasons that you know of. So we're talking about health reform that could impact everybody in this room, and the Democrats and President Obama want to move very quickly. That alone concerns me, whether we should move very quickly in 4 or 5 weeks on an issue that consumes 1/6 of our gross national product. But then we get down to that there are opponents on the left that want to create a government-run health insurance option to, quote, compete with the existing marketplace. They want to subsidize its creation, and hiding other startup costs. I believe the government will be artificially less expensive than options that exist today. It'll have advantages not available to those who provide coverage today and won't be, quote, competing on a distorted playing field. Now, if you're going to create a government-run health insurance program, and it's going to be the same and not going to have any advantage, then it's just going to be another one. We're going to have 1,501 health insurers in America instead of 1,500. So in itself, you should ask, why do we need a government-run healthcare system which will have no advantage over health insurance as it's provided today, unless it's going to, if it's going to be just another health insurer? And I believe that a government plan would be the big foot in the market and would cause mass transfers from existing coverage to the government plan that will be artificially less expensive than current options. This is a step to a government-run single-payer system and controls prices and leads to rationed care. We know from Medicare and Medicaid that government is unable to manage programs without controlling what doctors are paid and what care is provided to patients. The other big issue is a proposal to penalize employers, many of whom are just struggling to stay open and keep workers employed, with a health insurance mandate whether or not they can afford to provide coverage for their employees. These are the major issues that will drive the debate and the cost of their bill. I do believe that we should look seriously at a proposal that we made, and that is not only to remove the employer tax benefit for employer-provided health benefits, but give every American family a $5,000 refundable tax credit. They can go across state lines and get the health insurance policy that best fits their needs and their family. We need legislation, as we all know, but we don't need to create another costly government program. We should allow people to go across state lines, as I mentioned, and there's one other issue real quickly, and that is medical malpractice reform. I have not met a doctor in any specialty that hasn't told me in candor that they haven't prescribed additional tests and procedures simply for protection against a malpractice suit. Now, California and Texas, by the way, are two examples where malpractice reform has been enacted by the states, and guess what? It's doing pretty well. So the great debate goes on. I want the people who are doing this work every single day, 24/7, to be involved in this debate. You've got to be. We've got to have the benefit of your knowledge and experience. And there's no better place I know of in the United States than Phoenix Children's Hospital to get that kind of advice and counsel. Thank you for being here, and thank you for having me.